Welcome to Talk the Walk. I'm Sarah Wong. The Omicron variant has brought Hong Kong to its knees, with new cases surging at a rate never seen before. Hospitals are on the brink of collapse, while hours-long queues for testing stretch through neighborhoods. President Xi Jinping has ordered the SAR to bring the outbreak under control, but will the mainland's stringent measures also work for Hong Kong? Let's bring in Anthony Wu, CPPCC Standing Committee member and Sunrise Diagnostic Center chairman, to discuss the latest COVID situation in Hong Kong and the government's response. Anthony, sir, thank you very much for making time to speak with us.
You're welcome, Sarah.
Without further ado, Chief Executive Carrie Lam said it's considerable to test all 7.8 million residents in Hong Kong. Given what you've known, can you tell us what can Hong Kongers expect in the coming weeks, if not the coming days?
I think the government is still exploring various options, how to do it. And I think with COVID coming the rate it is, especially Omicron, I think we can very easily expect that we may have a daily over the 10,000 mark very soon. So, testing the bigger population is really very needed. We have just set up the Hoi-An lab in Mount San last Tuesday, which is in operation now, and that could increase the daily capacity by 100,000 single tube a day. And we have two more sets arrived, which are already in Hong Kong, and that could provide another 200,000. With the other labs, I think we do now possess the capacity to do more testing. The problem is people.
Yes.
If you know, let's say the top few labs, we employ, let's say 5,000 lab technicians. We were doing 50,000 a day 2 years ago, and now we're doing 300,000-400,000 a day. So really, we are working 7-11, 24 hours. And then you cannot just increase the people, the capacity by just doubling it, because you only have a finite number of lab technicians, and that is where we need help from the central government in sending more lab technicians to help us. And like in 2020, when we do this universal one, that they sent over 580 people to help us to do it. So, to increase the capacity, one is a physical capacity of the lab. To build a lab it takes a long time, but with the Hoi-An, you can actually set it up within a week. So we have all the devices, the equipments, and the air labs. And the most important thing that we're lacking now is people. And I understand the central government is working on it right now.
Now, you mentioned the manpower shortage when it involved testing. So shall the citywide mass testing scheme go ahead? What are you going to bring to the table to minimize the unpleasant hiccups that many residents have experienced in the past few weeks? Plus, now you mentioned there's an acute manpower shortage in the operation.
I think if we look at the whole testing process, there are three parts. One is, of course, the registration, that take your ID card and whatever. But the two major procedures, one is the swabbing, and the second one is the testing in the lab. Right. And the swabbing, I think if you want to do a district lockdown or whatever, then you need a lot more swabbers. And then you come to lab technicians. Swabbers are easier to train because it is actually quite a very simple procedure. Then with the one-day training or whatever, that I think a lot of people can do it. But for lab technicians, that is where we are short of. If the mainland can send over enough people to help us, and then we may be able to do, let's say, 1 million or 2 a day, and I think that would be great. But again, the physical capacity is here. All we need is a few more stadium or sports halls to set them up. The second thing, the most important thing, I think, is still human capital. It's human people. It's the human resources.
Right. You need more facilities. More importantly, you need more people. You need more manpower. Yeah. We know that a team of mainland experts just arrived Hong Kong yesterday, actually on Thursday, shall I say. So is that message, have you sent that message to them? Are they, do they understand what Hong Kong needs right now?
I think they do. I think if you remember, last Saturday, CS had a big meeting in Shenzhen with the mainland officials, and he has clearly pointed out what we wanted to do. And I think they're exploring various options on how to do it and how to do it quick and fast. And there is a big team of people in Shenzhen this week trying to sort out the people, where are the people going to come from and how are they going to help us, swabbers, lab technicians, whatever. And in fact, you have two sort of testing vans arrive in Hong Kong on Thursday, which would help a little bit with some of these testings.
President Xi Jinping has ordered Hong Kong authorities to bring the outbreak under control with all necessary measures. So apart from helping the SAR to set up a makeshift hospital, for example, and increase testing capacity, what will be those measures? And how far do you think that with the help of mainland experts, mainland medical personnel, we can bring the outbreak under control?
I think with the support of the central government, we can do this very fast. I think once we have set up this mechanism, how to do it, district-wide, area-wide, building-wise, or whatever, to do more testing, and with the physical capacity, with the support from the central government, I think we can actually do it in quite a short time. And then once you have identified all the carriers and isolate them, that could actually cut off the contagion chain, and that would help us go back to the normal situation.
Yeah, you talk about that, cutting off the transmission chains. I was just about to ask you that respiratory disease expert Ho Peck Lem, for example, he said the key to cut transmission chains is to promptly isolate detected cases. Now, boosting testing capacities and maybe bringing more testing personnel to help with the mass screening, it's great. But how on earth are we going to succeed to cut transmission chains if there's simply not enough space to isolate all those confirmed patients?
And Dr. Ho is absolutely right, and it's a problem we are facing right now. Once you've identified, you need to isolate them, because, I mean, if you leave the confirmed cases at home, they are going to transmit to the other household members. So isolation is very, very important, and I think the government now is really working very hard to find isolation facilities. And one of the suggestions that I've given the government is, how about those cruise ships, which can house 4,000 or 5,000 people? Because a lot of these confirmed cases, they have no symptoms or very light symptoms, and they need very little medical care, but they do need to be isolated. Otherwise, they will transmit to the other people. So we put them on a cruise ship, or we put it in some isolation facilities. I mean, that would help a great deal to cut off this chain.
What if it's not enough? Because yesterday, on Thursday, we already have 6,000 cases, and some experts predicted that we will soon see over 10,000 cases a day before it peaked. So what if there's simply not enough spaces to isolate all those confirmed cases? Will that be an adjustment to the current isolation policies, and what would that be?
I think the simple answer is, you do need to isolate them one way or the other. Leave them in the community. It's not going to help to cut off the chain. And I think we have to try whatever way to do it. And in fact, I mean, if they are already infected, you don't really need to put them in single wards. They can all be put in a big ward or whatever, because they all have the virus, so they're not going to affect each other. So I think, and I understand the government is working very, very hard, finding hotels, housing estates, and whatever to house this. And again, as I said, with this, what we call the dynamic zero COVID, the two major tools, one is testing, one is isolation.
Right.
Now that we know how to deal with the testing side, we do need to make sure that once you do the testing, how soon can you send the whatever number of people that we have identified to the isolation facilities?
So do you know that, in your knowledge, we know that mainland personnel experts are going to help us to set up a makeshift hospital like the one we've seen in Wuhan, like the one we've seen in Beijing during the SARS era. Do you know what's going on that front, and how soon can we expect to see something happen?
I really don't know the progress on that front, but looking at the experience in the mainland, they can build a hospital really in no time. But again, what I'm saying is, actually, do we really need hospitals? We need isolation facilities to isolate those confirmed cases. Because of Omicron, a lot of them have very light symptoms or even no symptoms, but you do need to isolate them. So they don't really need a lot of medical care. It's just somewhere that they could just live and for 7 or 10 days, subject to the expert's advice. And once they're tested negative for a few times, they could be discharged. I think that those are the facilities that we're talking about. We don't really need big hospitals to house them. But again, with the rate that it is going, we will have a lot of elderly or children that need to be hospitalized. So that is where the hospital would help.
So very quick, it sounded like that you don't think that home isolation, even for maybe young or maybe fitter individuals who are confirmed with COVID, home isolation still may not be a good solution for them.
It is not a good solution. Once you are confirmed, even preliminary confirmed, you should be taken to an isolation facility. Otherwise, you are going to transmit to all your household people, our household members.
I see. All right, let's pick it up after the break. We'll talk more on the other side of the break. Dr. Wolf will be back in a moment. Stay with us.
Thank you.